Carcinoma of endometrium. So, carcinoma of endometrium is the most common genital malignancy in developed countries, but in developing countries like India, carcinoma cervix is the most common. So, adenocarcinoma is the most common variety of CA endometrium. So, regarding the risk factors of CA endometrium, the risk factors of CA endometrium include the most important risk factor is it is an estrogen dependent cancer. So estrogen dependent cancer means unopposed estrogen exposure conditions can lead to like they have high risk for endometrial cancer. So persistent unopposed stimulation of the endometrium with estrogen is the single most important factor for the development of CA endometrium. So what are the estrogen unexposed estrogen Unopposed estrogenic states are PCOS, which includes anovulation and hyperestrogenism, and granulosa cell tumor of ovary that secretes estrogen. Then, unopposed estrogen therapy in hormone replacement therapy. So, hormone replacement therapy, both estrogen and progesterone are given to patients with intact uterus. So, there will be an unopposed estrogen action. So, early menarche and late menopause. This is also a condition. Where there'll be unopposed stimulation of endometrium with estrogen and there'll be more exposure to estrogen. The risk is increased if the menopause has not occurred by 52 years. So this endometrial carcinoma is an estrogen dependent cancer. So there will be persistent unopposed stimulation of endometrium with estrogen, which is the single most important factor for the development of CA endometrium. So what are the unopposed estrogen exposure states? They include PCOS with anovulation, hyperestrogenism, granulosa cell tumor of ovary that secretes estrogen, then unopposed estrogen therapy in hormone replacement therapy. In hormone replacement therapy, both estrogen and progesterone are given to patients with intact uterus, early menarche and late menopause. So there will be more exposure to estrogen. The risk is increased if menopause has not occurred by 52 years. So regarding the age, 75% postmenopausal patients will have endometrial carcinoma with median age of 60 years, and 10% patients with postmenopausal bleeding will have CA endometrium, and nulliparity is also a risk factor for CA endometrium. And corpus cancer syndrome. Corpus cancer syndrome means it includes obesity, hypertension, and diabetes mellitus. So these three conditions, that is obesity, hypertension, diabetes mellitus, these three are the triad of corpus cancer syndrome. So this syndrome is highly associated with CA endometrium, and obesity leads to high level of free estradiol. So the other risk factors could be tamoxifen therapy. So tamoxifen is a selective estrogen receptor modulator. It is used for breast cancer treatment and it has weak estrogenic action on the endometrium. Then Lynch 2 syndrome. So Lynch 2 syndrome is the hereditary non-polyposis colon cancer, HNPCC. Lynch 2 means HNPCC, hereditary non-polyposis colon cancer. It has increased risk of endometrial breast and ovarian cancer and atypical endometrial hyperplasia. Atypical endometrial hyperplasia can progress to CA endometrium in 20% of the cases. So to summarize all the risk factors of CA endometrium, so this CA endometrium is an estrogen dependent cancer. So persistent unopposed stimulation of endometrium with estrogen is the single most important factor for the development of CA endometrium. So PCOS with anovulation and hyperestrogenism, granulosa cell tumor of ovary which secretes estrogen, unopposed estrogen therapy in hormone replacement therapy. In hormone replacement therapy, both estrogen and progesterone need to be given in patients with intact uterus. Early menarche and late menopause, there'll be more exposure to estrogen and the risk is increased if menopause has not occurred by 52 years. So regarding the age, 75% patients are postmenopausal with median age 60 years. 10% patients with postmenopausal bleeding will have CA endometrium. Nulliparity is also a risk factor for CA endometrium. Obesity, hypertension, diabetes mellitus, these three are the triad of corpus cancer syndrome and it is associated with CA CA endometrium. Obesity leads to high level of free estradiol. Tamoxifen therapy is used for breast cancer treatment and it has weak estrogenic action on the endometrium. Lynch 2 syndrome or hereditary non-polyposis colon cancer syndrome is associated with increased risk of endometrial, breast, and ovarian cancer. Atypical endometrial hyperplasia can progress to carcinoma in 29% of the cases. So these are the risk factors, but there are some protective factors for CA endometrium. So the protective factors of CA endometrium are uh, COCs, combined oral contraceptives, then POP, progesterone only pills, then DMPA, depot medroxyprogesterone acetate, and Mirena, and finally pregnancy. So these are the conditions which are protective for CA endometrium: combined oral contraceptives, progesterone only pills, depot medroxyprogesterone acetate, Mirena, pregnancy. These five are completely protective for CA endometrium. Combined oral contraceptives will reduce the risk of endometrial cancer by 50% and the effect lasts for up to 15 years. There are four types of endometrial hyperplasias, that is simple, complex, simple with atypia, complex with atypia. So simple endometrial hyperplasia has 1% risk of progression to CA endometrium. Complex hyperplasia has 3% risk of progression to CA endometrium. Simple hyperplasia of the endometrium with atypia has 8% chances of progression to CA endometrium, and complex hyperplasia with atypia has got 29% chances of progression to CA endometrium. The pathology of CA endometrium is basically uterine enlargement. So the uterus may be enlarged due to myohyperplasia or pyometra. So the enlargement can be localized, diffuse, or microscopic. Uterine enlargement can be localized, diffuse, or microscopic. So localized enlargement will be sessile or pedunculated, and the usual site will be fundus. Myometrial involvement will be late. So if localized, then it will be sessile or pedunculated. Usual site is fundus. Myometrial involvement will be late. If diffuse, then it spreads through endometrium to invade the myometrium and it may reach the serosa. So in microscopic enlargement, adenocarcinoma is the most common variety of CA endometrium. 80% of CA endometrium cases are adenocarcinoma cases. So the other microscopic varieties will be papillary serous, clear cell, adenosquamous, mucinous, adenoacanthoma, squamous cell, mixed, and here papillary serous variety and clear cell variety will have worst prognosis, and among these two, clear cell variety has poorer prognosis. So regarding the spread of CA endometrium, there can be direct spread or lymphatic spread or hematogenous spread. So direct spread means the CA endometrium can directly spread to adjacent structures like myometrium, serosa, peritoneal cavity, cervix, fallopian tubes, and ovaries. Lymphatic spread can be to pelvic, para-aortic, rarely inguinal femoral nodes, and ovary and tubes and vagina. Pelvic lymph node involvement is 4% in stage 1, grade 1, and grade 2, whereas it is 35 to 40% pelvic node involvement in stage 2. The hematogenous spread will be to lungs, liver, bones, and brain. So clinical features of CA endometrium.